Okay, hey guys, Dr. Mark here. Just wanted to get on here and talk about the C1 atlas misalignment. So really common cause to a lot of our patients' issues is this C1 vertebra becoming misaligned. Okay, so the vertebra at the very top of your neck, it's like a ring and it sits right underneath the base of your skull. So your entire skull actually sits on one vertebra. That's part of why it's the most important bone in your whole body. And 90% of the motion in your neck comes from this one vertebra. So if you can't move your neck well from the right or to the left, the chances are it's the atlas that's involved. And so as you can see here, there's that ring. And so that vertebra can shift laterally. It can tip like this. It can be rotated, or it can be stuck in a position that pinches the nerves which go back into your head. And what's really unique about this vertebra is that you have your brainstem extending through the first vertebra and into the second one. So part of your brain is actually extending into your spine. If you look at this like on the model here, that top bone right there, that's your atlas. So again, it can subluxate or misalign rotationally like this. It can be tipped, or in the back here, it can be compressing these nerves at the very top of the neck. And the brainstem fits through this hole right here. That hole from your brain through your skull, it's called the foramen magnum, also known as the mouth of God, because your brain that's sending all of your signals to your spinal cord literally fits right through here. And so if the atlas is misaligned, you can have all sorts of issues. So your breathing can be affected. You can have vision or hearing issues. You can get headaches. Migraine headaches come from this top part of the neck being misaligned. Mood and mental clarity, people will say they have brain fog, or they just can't quite remember things or think clearly. That could be an atlas misalignment. Tinnitus, which is ringing in the ears, could come from that area. Even jaw pain or TMJ issues, all the way to neck pain, and even lower back pain could be affected by what's happening up here because it's the same spine. And so really the only way to find out is by taking x-rays. And so, looking at this x-ray here, the one on the left there, if you look at somebody from the outside, you can't necessarily tell that their atlas is misaligned because their head might look straight. But as you can see how that top bone is on an angle, what it's doing is it's compensating for problems lower in the spine, or creating problems lower in the spine from a primary misalignment up here. And so the only way to be able to tell is by taking the right type of x-rays and getting a proper corrective analysis of your C1 vertebra. This is why also adjustments might look similar. If you're watching patients get adjusted, they might look similar from patient to patient, but the actual angles and the specific corrective technique that's being used is custom to that patient, because we're using the x-rays. So if you know somebody that has those types of issues, again, vision, hearing, sinuses, mood, sleep, hormones, anxiety, even balance and coordination. If you know somebody that's dealing with those problems and they have not had their atlas properly analyzed, I just get them into a chiropractor, get them checked, let them see what is actually causing these problems, and get it resolved, because we've seen way too many people heal from those issues who have been trying symptom care and medications for years and sometimes decades. And when we can get to the cause, we can find healing for that patient. So just wanted to show you that, give you guys a little bit of a visual there, and hope you have a great day.